All right. Good morning, everybody. This is Ray Walker with the Oklahoma Insurance Department. I am so glad everybody could join us this morning for our third webinar in this series, Map to Open Enrollment. Thank you for joining us. Uh, we will have one more webinar after this one next Tuesday. That will be with Gay Humphrey, as you see here on the screen. Gay and Angela are joining us from the Centers for Medicare and Medicaid Services. I appreciate them coming on to help me with this topic today. I will be your speaker, so bear with me. But we're going to be talking about Part D prescription drug plans today. A lot of new things happening with those, that not just this year, but in the coming years. So wanted to welcome everybody that's joining us, both the beneficiaries, our counselors around the state that are joining us. We have some agents who are also joining us. Wanted to make sure that the agents understand that this doesn't give you CE credits. We're really glad you could join us for the information. If you want information about CE credits, you need to get on our website and go to the licensing information, and you can find out more information about that. So for anybody that missed our previous webinars that we've had, those are available on the OID website. You go to oid.ok.gov and go to the same place where you registered for these events, and the recordings of the previous webinars are available there. And today's recording should be available probably around 3 o'clock this afternoon if you need to go back and listen to that, or if you know someone that missed it that needs to hear it, it should be available there. So we are going to go ahead and get started. We're not going to mess with a bio because most of you people know me from working with me for this long. So I really want to jump into today's topic because I'm using the CMS presentation, by the way, which is huge. A lot of really, really good information, and unfortunately, we are time limited. Just as the other presentations that have been used for this series, these are all available on the CMS website. So there is a slide in here that will tell you where those are at. And I encourage you, there's some great information out on that CMS website. So take advantage of it. CMS has produced some items that are very specific to a certain diagnosis, like Medicare and mental health, Medicare and end-stage renal disease and stuff. So don't hesitate to go out there and take advantage of all of this material that's out there. It's there for your use, and it's free to the public. So without further ado, I am going to share my screen. And let's see if this is going to work. Now, Gay, if you can tell me which screen you are seeing.
Okay, I'm seeing the screen that's got the big slide in the middle, and then up the side are it's like a slide sorter. So you need to go up to the top to slideshow.
Well, actually, what I'm going to do first is I'm going to shift a couple of things around and then go back. And now I'm going to share my screen. Share. Now, are you seeing the same thing?
Yes.
All right, so now I'm going to start my slideshow.
There you have it.
Very good.
Okay, I see the whole thing.
Awesome. Good deal. All right, so let's get started talking about Part D prescription drug plans. This is the newest part of Medicare, as most of you know. Started in 2006. Gay was sharing with us last week how much fun that was when folks were just getting started with Part D prescription drug plans. But you know what? They've been a lifesaver because before that, beneficiaries had to pay for all of their prescription drugs. So these are all plans that are approved by Medicare. They are run by private insurance companies that are regulated by the Centers for Medicare and Medicaid Services, and they're available to everyone that's on Medicare. So as long as you're a Medicare beneficiary, you have access to these Part D prescription drug plans. There are two ways that people get this coverage. One is through a standalone Part D prescription drug plan that just provides the prescription medication. The second way is through a Medicare Advantage plan, those HMOs and PPOs that are out there that also provide the drug coverage. And we'll talk more about what that eligibility looks like for those two different options in a few slides. Now, these drug coverage plans, they have to offer a standard level of coverage that is set by Medicare. And these plans can differ significantly in terms of the combination of the drugs that they cover and the cost for those drugs. They often will also have a tier structure. In fact, in most, if not all cases, they're going to have this tier structure. And we've got a slide that talks about the tier structure here in just a moment. And then the cost for the different drugs that they cover is going to be different. And so that's one of the reasons why we encourage people every single year to review their drug coverage. Make sure that the plan that they're currently on is going to give them the best coverage for the medications that they take and for the pharmacies that they use for the coming year. So in 2023, most people are going to pay. I've adjusted these so that you can actually see that some of the costs for next year have been released, some have not. So I've tried as much as possible to insert the 2023 numbers for you guys. So in most situations, let's say that a person's on a Part D drug plan, they're going to pay their monthly premium, because all of the Part D plans do have a monthly premium. And then a lot of the plans are also going to have a deductible. Now, the maximum the deductible can be for 2023 is $505. It did go up some. Then once the person has met their deductible, they go into what's called the initial coverage phase, during which time the beneficiary and their drug plan will be paying for their prescriptions. And in most cases, what they pay out of pocket equates to around 25% of the cost of those drugs. And what their health plan, or excuse me, their drug plan pays is about 75%. And once what the individual pays in terms of their deductible and their portion of the initial coverage phase, and what the health plan pays in the initial coverage phase comes to $4,660, they go into what's called the coverage gap, or the donut hole. And that used to be a much bigger deal than it is nowadays. In the beginning, when a person went into the coverage gap, they became responsible for 100% of their drug costs once again. And it was very challenging for a lot of people. But over the course of several years now, thanks to legislation that was passed several years ago, the discounts that people receive while they're in the coverage gap have increased over time, to where now when a person actually goes in the coverage gap, they're paying approximately 25% of their drug costs. So some people do see an adjustment in what they're actually paying while they're in the coverage gap, but it's still much less than what it was previously. Then once a person is in the coverage gap, they continue paying that 25% of the cost for their generic drugs as well as their brand name drugs. And when their out-of-pocket costs reach $7,400, they go into what's called catastrophic coverage, at which point in time they'll pay at the most 5% of their drug costs. So here's an example of how that works. We're talking about Ms. Smith here, and she joins a Medicare drug plan, and her coverage is going to start January 1st. This individual doesn't get extra help, and if you're not familiar with extra help, we're going to talk about it in a minute. So beginning of the year, she starts out by she's got to meet her deductible. So she's going to pay the first $505 of her drug costs. Once she's met that deductible, she goes into that initial coverage phase, at which point in time she's going to pay approximately 25% of the costs, and her plan, her Part D drug plan, is going to pay approximately 75% for each covered drug. They have to be drugs that are covered by her particular plan, until their combined total comes to that $4,660. Then Mrs. Smith is going to go into that coverage gap, at which point in time she is going to pay about 25% of the cost of her prescribed medications. That's for both generic and brand name drugs. All right. Now in 2023, the drug manufacturer is going to provide a 70% discount on all of the brand name prescriptions that the individual, in this case Ms. Smith, takes. And the health plan that she's on is going to give her an additional 5% discount or they're going to pay that 5% on her brand name drugs and 75% coverage on the generic drugs. Now, I know that seems like a weird way to break things down, but it'll make more sense in just a minute. After the amount that has been paid by Mrs. Smith gets to $7,400, then she goes into that catastrophic phase where she's going to pay no more than 5% of her drug costs. Okay? Now, the reason why that 70% of what is paid in terms of a discount from the drug manufacturer is important has to do with her true out-of-pocket costs. So what is her true out-of-pocket costs? Well, the troop is the expenses that count toward getting her out of that catastrophic phase, that get her to that $7,400, because not everything that's spent goes toward that, such as the money that is paid by the health plan, her Part D prescription drug plan, that doesn't count toward that. But the money that she pays out of her pocket does, and a few other things, and I'll share those with you. If I pay for a drug out of pocket because it's less expensive, can I count that toward the troop? Absolutely. The pharmacist can tell you if there's a better price out there, if maybe you can get a better deal using a good RX or something like that, or maybe there's just, the drug itself is just cheaper. They can tell you, and we're going to talk about how you can get credit for that toward your true out-of-pocket costs. Where can I find my true out-of-pocket cost for the year? That's going to be on the explanation of benefits that's provided by your Part D prescription drug plan. What happens if I reach the threshold? Well, you go into that catastrophic phase, and that saves you a lot of money. So what if I switch plans during the middle of the year? Because there are times whenever that might possibly happen. Well, that's okay. Your troop travels with you. So if you've spent money under one plan, when you go to that new plan, your troop balance just transitions right over to that new plan with you. So what actually counts toward that true out-of-pocket cost to get you through those different phases? Any payments that are made by the individual or by their family members or friends, any payments that are made by a qualified state pharmacy assistance program, which at this time Oklahoma does not have one, any payments made by Medicare's Extra Help program, and we'll talk more about what Extra Help is in a little bit. Payments made by Indian Health Services also count toward the troop. Payments made by AIDS drug assistance programs, payments made by most charities, payments that drug manufacturers provide on brand name drugs under the Medicare coverage gap discount program. And that's that 70% that we were talking about. When they're in the coverage gap, the drug manufacturers provide a 70% discount. Well, that 70% discount, we get to count that toward that troop. Now, there are some things that don't count toward the troop. Those are any amounts that are paid by the drug plan. So we talked about how when a person goes into the payments that are made by the drug plan in that initial phase, those don't count toward the troop, and the 5% that's paid for brand name drugs and the 75% that's paid for generic drugs in the coverage gap don't count toward the troop. The monthly premiums that you pay for your Part D drug plan don't count toward it. Drugs that are purchased outside the United States, so if you've been running down to Mexico to get your drugs, those don't count either. Drugs that are not covered by your plan. That's one of the reasons why we stress to people you want to make sure that all your prescription drugs are covered by your Part D plan. Drugs that are excluded from the definition of a Part D drug, and we'll go over what that definition is in a couple of slides. Over-the-counter drugs or most vitamins also don't count. And then also any payments that are made by or reimbursed to you by other insurance, such as if you're on a group health insurance plan, the government-funded programs, such as like TRICARE or Medicaid or something like that. Other third-party groups, patients' assistance programs operated outside of the Part D benefit, and other types of insurance. Now, real quick, we want to talk about IRMA. And this is the income-related monthly adjusted amount. Now, IRMA is an extra amount that some people have to pay in addition to their plan premium. It's based on income. So people in a higher income bracket, which we'll look at on the next slide, are required to pay more for their Part D prescription drug plan. The same uh, process applies to Part B, as in boy, of Medicare. So those same high income people are asked to pay more for Part B as well. Does everyone pay IRMA? No, it's based on your income. So fewer than 5% are actually paying on IRMA. So what if I owe Part D IRMA, but I don't pay it? Unfortunately, you will be disenrolled from your Medicare drug plan. So it's not a choice. You do have to pay it if you're in that income bracket. Now, where does the money go? Because some people are like, well, I don't think it's fair that I have to pay my drug plan more than anybody else. Well, that extra money doesn't actually go to the drug plan. It goes to the Medicare Trust Fund. So it's it's not going to the individual plan. So here is the income information on who exactly is going to fall into the IRMA income brackets for 2023. And as you can see, if you're someone that files your taxes individually, oh, and by the way, this is based on your income tax return from 2 years ago. So for 2023, they'll be looking at your 2021 tax returns. So if this is a person that's filing an individual tax return and their income is 97,000 or less for 2021, or if they file jointly, it's 194 or less filing jointly, then they're just going to pay their prescription drug plan premium as it is. They don't have to add anything extra. But as you can see on this chart, if they fall into one of those higher income brackets, then they're going to be asked to tack on that extra amount that's in that last column. And again, this only impacts about 5% of all Medicare beneficiaries. Over the course of the years that I've been doing this counseling, I've never really had anybody that's gotten very upset if they're in those much higher income brackets. So let's talk about the coverage rules. So to be covered by a Part D drug plan, excuse me, my allergies, my nose is itching. Is that supposed to mean company's coming or what? I can't remember. So they have to be prescription brand name and generic drugs that are approved by the U.S. Food and Drug Administration and sold in the United States for medically accepted indications. They also have to include prescription drugs, biological products, and any of the supplies that are associated with the injection of insulin. And the plans have to cover a range of drugs in each category. They can't limit it to just one type of drug for a certain condition. They are required to cover all drugs in these 6 protected classes: cancer drugs, HIV/AIDS drugs, antidepressants, antipsychotics, anticonvulsants, and immunosuppressive drugs. They also have to cover all commercially available vaccines, including the shingles shot. And I've got some more information about that coming up in a later slide. Not all vaccines are actually covered by Part D. A lot of them fall under Part B, as in boy, like you get your flu shot, your pneumonia shot, your COVID shots also are falling under Part B. There are some drugs that are excluded by law from Medicare drug coverage. That includes any drugs for anorexia, weight loss, or weight gain. Erectile dysfunction drugs also when they're used for the treatment of a sexual dysfunction. Now, some erectile dysfunction drugs are actually used for other conditions. We've had individuals who had coronary type illnesses where those drugs were used, and they work with their physician to actually make the case to the Part D plan so they understand why that drug is being used. Fertility drugs, drugs for cosmetic or lifestyle purposes, drugs for symptomatic relief of cough and colds, and prescription vitamins and mineral products, as well as over-the-counter drugs. Now, the plans can also manage your access to drugs using several different methodologies. One of those is, we've talked about, they have a formulary for all of these Part D plans. And the plans are going to use this drug list to make that's how they maintain which drugs they're going to cover on that particular plan. So again, this is where that comparison becomes so incredibly important, because all it takes is for someone to enroll in a Part D drug plan and have one of their medications that's not on the formulary for that plan, and all that potential savings goes down the drain. So we really want to make sure that all your scripts are covered by that plan. The next one on here is prior authorization. So this is a situation where before the drug plan will cover a drug, your prescriber has to work with you to get a prior approval to show why that drug is necessary for your treatment and why something else wouldn't work just as well. The third option here is step therapy. And it's kind of like prior authorizations. With step therapy, the Part D plan has established before we'll cover this more expensive drug, you have to try this other cheaper drug, probably a generic, that's been shown to be just as effective as the higher cost drug in the treatment of your condition. Now, and if you try that drug and it doesn't work or you have an adverse reaction to that drug, then you can take the more expensive drug. Now, your doctor, your prescriber can actually request an exception if there's a danger, if there's a reason why they're concerned that trying that cheaper drug might actually be a serious problem. That prescriber can make a request for an exception so they don't have to go through that step therapy process. And then the last one you see here is the quantity limits. And that's where the plan limits the quantity of the drugs over a period. And that can be for safety purposes. Maybe this is a drug that has a risk of overdose or something. It can also be based on the cost. If this is a high cost prescription drug and there's the potential that you might not be on the drug for a long period of time, then putting that limit on there, I mean, I don't know of anybody who doesn't have, I've got prescription medication sitting on a shelf that I haven't touched, that I didn't finish, that, by having a quantity limit on it, you can keep that high cost medication from just sitting there going to waste. Now, let's talk about formulary tiers, because one of the ways that they can manage the costs in these Part D plans is by establishing these tier structures so that they establish what you're going to pay based on the tier that drug falls on. Now, this is just an example. This isn't how all of the tier structures are set by each plan because they can all be different. But in this example here, let's say that tiers 1 and 2 are going to be those preferred generic drugs or just generics. Preferred, by the way, does not mean that it's the best drug to treat your condition. Preferred in this scenario means that it's a drug that the Part D plan has a favorable contract with. It's gonna be a cost savings. So that's going to have the lowest copay, the lowest out-of-pocket cost for the beneficiary. A tier 3 drug might be a preferred brand name drug. So it's a brand name drug, but again, the Part D plan they've negotiated a good contract for that brand name drug. Tiers 4 could be a non-preferred brand name drug, a drug that they've negotiated a rate, it's not a great rate, so they'll put that on tier 4 where it's got a higher copayment. And then the highest tier, or the specialty tier, is going to be for those very unique high-cost drugs for those very special conditions. It's probably going to have the highest copayment or coinsurance. And when you hear those terms, by the way, copayment versus coinsurance, a copayment is typically a set amount of money, such as $10, $20, $30. So you'll hear people talk about a $10 copayment or a $20 copayment. A coinsurance is a percentage. So a person may have a 10% coinsurance or a 20% coinsurance. Now, the insurance plans used to be able to require pharmacists to not reveal information about ways that people could save money. They were prohibited from discussing if the drug could be made available if a person didn't use their insurance. But because of the Know the Lowest Price Act, I believe it was in 2018, they can't do that anymore. So it prohibits Medicare drug plans from restricting or penalizing pharmacies from disclosing price information. It also allows pharmacies to disclose the difference between the negotiated price of their drug plan and the lower price available without using any health insurance. And it gives the enrollees the options to pay cash at the pharmacy for their prescriptions and then submit a claim to their Part D drug plan so that it counts toward that true out-of-pocket costs. So this is a way that, we saw earlier where anything that the individual pays counts toward that true out-of-pocket cost, but you don't have to use your insurance to do that. You can get that receipt. You do have to do it. It's not going to be automatic. You'll have to get the receipt and then submit it to your Part D plan. And then you want to follow up and watch your explanation of benefits to make sure that that shows up on your explanation of benefits and that you get credit for it. And I always remind people, if you do this, send a copy. Don't send the original because it can get lost. So let's talk about the Part D coverage, eligibility, and enrollment. There's a couple of different ways, as we said earlier, that people get their drug coverage in the Medicare system. If they want to get it from a standalone Part D prescription drug plan, they have to have Medicare Part A or Part B. They can have both, but they have to at least have Part A or Part B to get a standalone Part D drug plan. If they want to get their drug coverage through a Medicare Advantage plan, they have to have both A and B. They also have to join a plan. It's not going to be automatic. Some people will, if they've started their Social Security benefits, they automatically get enrolled in Medicare Part A and Part B. Drug coverage doesn't work that way. You have to actively pursue getting into a drug plan in most cases. You also have to live in the plan service area. Now, if you're getting your drug coverage through a standalone Part D drug plan, most of those have very, very large service areas. In fact, some of them are even nationwide. If you're getting your drug coverage from a Medicare Advantage plan, that's probably not the case. They're going to have a much smaller service area. So you need to make sure you're in the plan service area if that's how you're going to get your medications. You cannot be incarcerated, and you can't be unlawfully present in the U.S. to get a Part D drug plan. You also cannot live outside the United States. Now, creditable coverage. This is a term that you're going to hear in dealing with Part D drug plans and drug coverage and stuff. The term creditable drug coverage means that this coverage is expected to pay at least as well, if not better, than Medicare standard drug coverage. Now, if you've got coverage that potentially could be creditable drug coverage, the best way to find out is ask wherever you're getting that drug coverage from, such as if you're employed and you're still working and you've got employer coverage that's including drug coverage, ask your employer, is our coverage considered creditable by Medicare? If you've got a retiree plan that's providing you with drug coverage, ask the benefit administrator for that retiree plan, is our coverage considered creditable? They'll know it's something that's important, and they'll be aware of that. So you want to know if that coverage is creditable. The reason why is because if you are on Medicare and you go more than 63 days or more without creditable coverage, you could wind up paying a penalty. We're going to look at an example of that penalty here in just a second. So we want to make sure that people understand how important it is that they maintain prescription drug coverage and they don't have any lapses in that coverage. Now, there's a lot of different coverage that does count as creditable drug coverage, such as coverage through Indian Health Services, coverage through Veterans Administration, TRICARE, TRICARE for Life. Most employer coverages count as creditable coverage, but it's very important that you clarify and you make sure that you've got that creditable coverage and that you don't go more than 63 days without it. So, the other thing that you want to be careful about is, let's say that you do have other coverage. Maybe you have employer coverage, or maybe you're not employed anymore, but you've got COBRA coverage and you've got family members that might be on that coverage, or some other kind of coverage that is taking care of your healthcare needs, as well as potentially some family members. Be very cautious about joining a Part D drug plan or taking any actions related to your insurance without checking with the people who are providing that coverage to you, because sometimes by enrolling in another product, you can cancel both the health and drug benefits under that previous coverage. And we've had situations in the past where an individual, thinking they were just going to add some additional drug coverage, what could it hurt? But when they enrolled in that plan, it canceled their retiree plan. So be very, very careful. Don't take any action like that without talking to someone first, because you may not be able to get that coverage back. So the first opportunity that somebody has to get enrolled into a Part D prescription drug plan is going to be the initial enrollment period, which is when their Medicare starts. Here's an example, a graphic that shows you that. And that initial enrollment period is that 7-month period that includes the 3 months prior to the month in which they turn 65. And if they get enrolled during that previous 3 months, their benefits are going to start the first of the month in which they turn 65. If they wait till the month in which they turn 65, their benefits will start the first of the following month. Now, if they wait until one of those later 3 months, starting in 2023, you'll see in the past, if they waited till one of those later 3 months, their coverage might not start for 2 or 3 months. But beginning in 2023, it will actually start the first of the following month. So let's say that a person waits until the 5th month to enroll in Medicare Part D. Their benefits would start in the 6th month, as you see on this graphic. And as I said before, you may automatically get enrolled in Part A and Part B, but you still have to choose a Part D drug plan. And that's important because, as I said before, if somebody were to assign you in a Part D plan, they don't know what drugs you're taking. You need to go through the process, sit down with a counselor, and actually review your drug list, talk about the pharmacies that you want to go to, talk about where you live, because all of those are very important in terms of choosing the right drug plan for yourself. So here's an example. Mary turned 65 in May. Happy birthday, Mary. And she applies for Medicare, a Medicare drug coverage in February, March, or April. Her coverage is going to start in May. But if she waits until May, it's not going to start till June 1st. If she applies in June, July, or August, her coverage is going to start the first day of the next month. Now, there's a little known fact, and you see it here at the bottom of this screen. I'm glad they included this. If a person's birthday is the first of the month, so in this case, let's say that Mary's birthday was May 1st instead of May 5th, her benefits would actually start the first of the previous month. So May 1st birthday means a April 1st effective date on Medicare. So don't ask me why. Nobody asked me, but that's the way it is. Now, the next opportunity for somebody to either join or change their Part D prescription drug plan is going to be the open enrollment period, which has started. Saturday was the first day for this year. So October 15th through December 7th is this 7-week period, and any changes that we make are going to be effective on January 1st. This is the time when people enroll, disenroll, switch. They can also, this is when they're doing their Medicare Advantage plans as well as their drug plans. And we really hope that people take advantage of this time of year. I can't tell you how much money a person can save. Even if their drug plan has been doing great for them all year long, so much can be saved by making sure that you're on the right prescription drug plan each and every year. Now, there's also a Medicare Advantage open enrollment period. This is for those people who are getting their prescription drug coverage through a Medicare Advantage plan. This is fairly new, and this is a time period that's January 1st through March 31st, and it's specifically for people who are on a Medicare Advantage plan as of January 1st. And during this time period, those people can switch to another Medicare Advantage plan with or without drug coverage. They can drop their Medicare Advantage plan and go back to original Medicare. And if they do, we think they need to enroll in a Part D drug plan because they don't want to go without their medications. And any coverage changes they make are effective the first of the following month. There are special enrollment periods that can occur, such as if you permanently move out of the plan's service area, if you lose other credible drug coverage, such as you quit working and you decide to retire. Also, if you weren't properly told, if you were not informed by your employer that the coverage that they were offering was not creditable. if you enter, live at, or leave a long-term care facility, if you join or switch to a 5-star plan. Also, we're going to talk about how extra help, being in the low-income subsidy, the opportunities that you may have for additional enrollment periods throughout the year. If you've been assigned into a plan by CMS or by the state, you have options to change to a different plan that might be more favorable to you. So these are those special opportunities that I was talking about. So for people who have extra help, or maybe a Medicare savings program or Medicaid, they've got additional opportunities during the year to make changes on their Part D coverage. They can make one change per calendar quarter in the first 3 quarters of the year, and then they can also make a change during the open enrollment period. Now, they are limited to one change at each one of these time periods. Now, they also have another 3-month special enrollment period if they gain, lose, or have a change to their Medicaid or extra help status. So if they were partial extra help and they go to full extra help. Also, if there's notification of a CMS or a state-initiated enrollment action, such as like a public health emergency or a natural disaster or something like that. So things to consider before joining a plan. Do I have other current health insurance? Is my drug coverage as good as Medicare drug coverage, which we said is considered creditable? How does my current coverage work with Medicare? Do I have, drug coverage, and would it work with the coverage that I currently have? Or do I even need drug coverage with the coverage that I've currently got? Could joining a plan affect my current coverage or my family members' coverage? Now, the ways you can get enrolled in Part D, you can go to the website and the tool that we use is Medicare.gov, the Plan Finder tool. You're allowed to enroll straight there from that particular website. You can talk to one of our counselors, 1-800-763-2828. That's MAP, Medicare Assistance Program there. By phone, you can call 1-800-MEDICARE. I will tell you, folks, it's an incredibly busy call center. They get tons of calls this time of year. So you might be in a better position if you contact one of our counselors. By the way, we do work with numerous agencies around the state who also offer counseling. So if you live in another part of Oklahoma and you'd like to talk to someone locally, give us a call. We would be happy to point you to the local agency that is trained to do this counseling. We also have a number of counselors throughout the tribes here in Oklahoma that we can help direct you to if you'd be interested in talking to one of them. You can also do a paper enrollment form. Now, every year, once you are on a Part D prescription drug plan, you will receive these 2 documents every year around this time. One of those is the annual notice of change, or the ANOC letter. You will get that no later than September 30th. And as the name says, it tells you what's changing for the coming year. Are your premiums going to change? Are the drugs lists going to change? What about the co-payments that you're paying for those medications? Has their pharmacy network changed? All of that would be contained in that letter. There's another document called the evidence of coverage. And that also comes out. It has to be out no later than October 15th. It's a much more detailed document that tells you what the plan's service area details, their benefits, the formulary, all of that type of information is in there, including how to file an appeal if you get an adverse decision from your Part D plan. Now, there is a late enrollment penalty if you don't enroll in a Part D plan when you should. We talked earlier about how you should not go more than 63 days without drug coverage. So if you don't have creditable drug coverage, if you're not on extra help, you may be required to pay a penalty, and you would receive that notice from your Part D drug plan. The penalty is 1% for each full month eligible without having creditable drug coverage. And you multiply that percentage by a number that's called the base beneficiary premium, which is established every year. For 2023, it's going to be $32.74. And that amount does change every year. So let's look at this example. And she didn't join when she was first eligible, which would have been May 31st of 2019. But she joined a Medicare drug plan during the 2021 open enrollment period, and her coverage began January 1st of 2022. So she was without creditable drug coverage from June of 2019 to December of 2021, which is 31 months. Her penalty in 2022 was 31%. So it's 1% for each month, for each of the 31 months, and that is multiplied by what the base beneficiary premium was for 2022, which was $33.37, which came to $10.34. So the monthly penalty is rounded to the nearest 10 cents, and so Anne was charged an additional $10.30 in addition to her plan premium for the year 2022. Now let's look at 2023 for Anne, because as it said on the previous slide, it gets recalculated every year when that base beneficiary premium changes. So this year, the base beneficiary premium actually went down a little bit. It's $32.74. So again, we've still got the 31 months because she joined a plan. She doesn't have any additional months that she didn't have coverage. So it's still based on the 31 months she didn't have coverage. And the base beneficiary premium is $32.74. So you calculate that out, which came to $10.15, rounded to the nearest 10 cents. So her penalty went down a little bit. Her charge, it's going to be $10.20 added to her monthly premium. Now, keep in mind, and I'm hoping did a review of her coverage for the current year and may have switched to a different Part D prescription drug plan. So she may have a different monthly premium for that plan, but the penalty that gets tacked to that will still be the $10.20. It has nothing to do with the premium for the plan that she selects for 2023. Now, quickly, I want to touch base on Extra Help. This is an assistance program that is available through the federal government. You apply for it through Social Security, and it helps with the cost for Part D prescription drugs. So there is income and asset limits for this program, and if a person meets those income and asset limits, it lowers their copays. It pays their monthly premium. It lowers their copays. They don't go into the coverage gap every year. They also don't have to worry about the late enrollment penalty. So if there's somebody that didn't enroll when they were supposed to, but they meet the income and asset limits, that's okay. They don't have to worry about the penalty. So it's definitely very beneficial to people to apply for this program. So here are now unfortunately they have not released the 2023 income and asset limits, but here's the information for 2022 that we've been using this year. So this information is available on, you can literally Google Extra Help and find this information, and hopefully pretty soon we're going to have the 2023 information out. And this tells you what the benefits look like. So if someone is on Extra Help and they're living in an institution, or they're what we call a full benefit dual, maybe they're not living in a nursing home, but they're getting help through home and community-based services, they're not going to have a copayment. For those people who are full benefit dual eligibles, you see their copays there, and I won't read this off to you. You're able to read. So just wanted you guys to be aware, this program is available. It's a huge help to people. And so we encourage people to get enrolled whenever possible. The other thing to keep in mind is if you've applied for this program and you didn't get it, reapply. If anything changes, there's no cost to applying for this. And we can assist people with the application process. They can call us at our 800 number, the same number that they call for counseling, and get assistance. I also wanted to make you aware the program for this is actually a partnership grant with our folks over at Oklahoma Human Services, what used to be called the Department of Human Services. They also provide this same counseling. And this map will show you the states. They've kind of taken the state and divided it up into different categories. And you'll see to the left over here the name of the person that covers that part of the state and their phone numbers. And these ladies are awesome. They do a great job of counseling people, not just on Extra Help, but on the Medicare savings programs and other assistance programs that are available throughout our state to help those low-income individuals get the care that they need. So these people are a godsend to all of us. Now, wanted to tell you very quickly, and then we'll get to questions. There are some changes that are coming about as a result of the Inflation Reduction Act that just passed in August. Not all of the changes take place in 2023, but there are some important ones that you need to be aware of. One of those is insulin. Beginning in 2023, the cost of insulin is going to be capped at $35 a month. So that means that an individual who is insulin dependent will only have to pay $35 per insulin per month for their insulin injections. Now, their injectable insulin. Now, for those people who get their insulin through a insulin pump, which is covered by Part B as in boy because it's a piece of durable medical equipment, the insulin that goes into that pump is also covered by Part B. Their insulin cap at $35 will not start until July 1st. So it's going to be a little bit delayed. But if you're one of those people that are actually still using syringes and you're injecting your insulin, then that change is effective January 1st. So if you take a form of insulin, we want to make sure that the insulin you take is on the plan that you select. And if so, then it's going to be capped at $35. Now, if you're one of those people who's a self-doer and you like to get on the Plan Finder and look at it yourself, be aware, don't panic. Plan Finder doesn't actually reflect that $35 change yet. It has to do with statutes and when people had to turn in their cost information and stuff. So it's not going to be reflected in Plan Finder. But never fear, the change will be effective January 1st. So that's a really good thing. The other thing that's going to be great starting in 2023 is they are eliminating the cost sharing for adult vaccines that are covered by Part D, as in dog. So those vaccines, we talked earlier about how the Part D plans cover those things, such as the shingles vaccine. And I know of a lot of people that delayed getting their shingles vaccine because the out-of-pocket costs were so high. Well, guess what? Now you can get that shingles vaccine, and the cost sharing is eliminated. So no more excuses for not getting your shingles vaccine. So, and then there is also a rebate that any of the manufacturers have to pay if their prices increase faster than the inflation rate. Now, starting in 2024, there are some more changes, such as the 5% coinsurance. We talked about those people who go through the different phases, including the donut hole, and they get to that catastrophic phase where they have to pay 5%. Well, when you think about it, a lot of those people that are on the drugs that get to that catastrophic phase, they're there because their drugs cost so much. So even at 5%, that can be a lot of money. Well, beginning in 2024, that 5% coinsurance is going to be eliminated. So those people, when they get to the catastrophic phase, aren't having to pay that. Also in 2024, they're going to raise the cap, the limit for full extra help. Right now, a person has to be at 135% of the federal poverty level to receive the full extra help benefits, where the extra help program will pay their full Part D monthly premium and lower those copays. They're going to raise that to 150% of the federal poverty level. So more people will actually qualify for full extra help. And then in 2025, and this is probably the last one I'll have time to go over, they are going to put a cap on the out-of-pocket expense for Part D drugs. So $2,000 will be the cap on how much an individual has to pay for their Part D covered prescription in 2025. That's going to be a huge game changer for a lot of people. Now, we've heard a lot in the press about that CMS is going to start negotiating drug prices for the high cost drugs. That will actually not take effect until 2026, but it is coming. But wanted you to be aware of that. So great changes coming about as a result of the Inflation Reduction Act. So key points to remember, drug coverage under different parts of Medicare depends on medical necessity, healthcare settings, medical indications, legal statute, and any special drug coverage requirements. You can get Medicare drug coverage through a Medicare drug plan or through a Medicare health plan, also called a Medicare Advantage plan with drug coverage. Most people must take action to enroll in a plan. Some people will get automatically enrolled because they're on some type of assistance program, but the vast majority of us actually have to choose a plan and enroll in it. A delay in joining may result in a late enrollment penalty. There are programs out there to assist low-income individuals, such as the Extra Help Program, the Medicare Savings Programs, And if you want more information about those, we can assist you with learning more about that. There are other resources that are available through Medicare. Here you can see some different phone numbers, the number for Social Security. Um, there's a resource if by chance somebody here is looking to find out, is there a program like the Medicare Assistance Program in another state? You can go to the website shiphelp.org, and there's a search engine there where you can find the program like ours in another state. Now, I am going to stop sharing and see, did we have any questions? Now, Gay, were you going to read those?
I was going to, yes, I was.
Thank you.
Some of these I've answered, but, and I tried to include everyone. However, we failed to mention at the beginning of the presentation that if you have questions as Ray goes along, please just enter them in chat. And maybe you already knew that, but anyway, we didn't say it. So then I sent out a chat to everyone. But anyway, we didn't get very many questions, but that's a good thing, Ray, because that means you did a really great job of explaining this program. So let me just go to the chat questions that we received. Let's see, let me start at the beginning. Will we be getting printable material on these slides? Yes, Ray, we just need a link to the materials that you shared today. If you can.
Let me find out how I need to do that. I gotta
Well,
figure out how to do it.
okay, you can just share the Part D presentation from the National Training Program. Just go
That's a
in,
good idea.
and pull that up, copy that link and just put it in chat.
Hang on, you okay? Keep talking, and I'm getting there.
Okay, all right. All right, so we got that one. Let's see, let me go up and up here. All right. Okay, no, this just keeps jumping like crazy. All right, here's someone whose initial enrollment period was last year. He turned 65, only has Part A, because he has creditable coverage from Aetna through his wife's company.
Mm-hmm.
So this person is saying, he contacted his benefits folks with his wife's Aetna plan to let them know I do have Medicare as well. I have Part A, so they know that. And now he's ready for Part B and Part D with a Medigap policy. He's not going to be penalized for enrollment, right? And that's
No,
exactly right. He will
no,
not be.
he can while he's still covered by his wife's plan, he can disenroll. Well, he can enroll in Part B at any point in time while he's got his wife's coverage. And then once he's not covered, if he still hasn't started his Part B, he's got up to 8 months to get his Part B going. But he's only got 63 days to get the drug coverage. So probably would be a good idea if she's fixing to retire or anything like that, go ahead and get it started before she actually retires so you don't have any kind of lapse in coverage.
Thank you, sir. All right, there's a printed material one. And then we had an interesting question here. An individual called and asked about Botox injections that she's taking for a cervical disorder. So she gets the Botox through her prescription plan, and it's injected at the doctor's office. Now, how is this going to be covered? And also, will this prescription count towards the $2,000 cap in 2025? So, in looking at this, the thing that we want people to be aware of is the fact that the prescription, if the plan covers this particular Botox product, the prescription drug would be covered by her plan, which is what she said she's doing now. Part B would cover the doctor's office appointment for the injection. So Part D would cover the medication. Part D would cover the medication. Part B would cover the doctor's visit. And it may be that, she just needs to go ahead and go to the pharmacy and get that medication and take it with her to the doctor. They may not keep it there at the doctor's office. So now, according to everything that I've seen, which is not a whole lot on the cap in 2025, we don't know all the specifics yet about that, and we won't for a little while. But the one thing that I can assure you is Medicare will make sure that Medicare beneficiaries are well aware of the changes that will come about because of this cap. And, there may be other changes as well. And once that happens, then, there's no need to call the plan now and say in 2025, are you going to be covering this? You just are going to need to wait. But, that guidance will be coming out, but I don't expect it anytime just real quickly. But we'll have plenty of time to decide if maybe you need to find another plan or something like that. All right. And the plans, of course, are going to let you know as well. All right. If you see here in the chat, Ray has got the link to the PowerPoint that he trimmed down a little bit for this presentation today. He put it to everyone in the chat, so I'm just going to let you pick that up. But when you see that and you go into the National Training Program website, there are several options, and one of them is classroom modules, and that's where you want to go to pull up the information, the listing and find Medicare Part D, Medicare prescription drug coverage. Is that right, Ray?
Yes.
Okay, I wasn't sure by the look on your face if I was speaking.
Well, because I'm looking at two different screens, and it was a lot of information. It was great information, but I would strongly encourage anybody that's very interested, take the time, go out there, because not only does it give you the slides, but the talking points are very informative too.
Absolutely, absolutely. And you did a great job paring it down to fit the time that we had. So. He thinks so too. All right. Does anybody else have a question that you'd like to put in the chat? Please go ahead and do so. That'll be just fine with us. We'd love to see that. But Ray, I want to say from CMS and especially from the Dallas Regional Office, how much we appreciate all the work that you do there in Oklahoma. You're a terrific ship director, and you've got just wonderful volunteers. And I don't know how you screen them, but you always get good ones. So we do appreciate all that. There is no way that open enrollment could be a success without the work that you do, and we are well aware of that. And just want to say thank you, and for your availability for anybody in the state who needs help, for CMS, and somebody who sent a little hand clap emoji up the wall. But anyway, thank you.
Thank you very much. We enjoy working with CMS. We all love what we do. This time of year, it's a lot of work, but oh my gosh, we are so glad when people take advantage of this opportunity to maximize their benefits. There's so much out there that CMS is doing to help seniors make the most. And gosh, don't waste this opportunity.
Yeah. One more thing I'd like to say about the insulin, and that it's not included the $35 per month for insulin products. So if you take two different kinds of insulin, then you'll have a $35 copay for the month for each one of them. So your copay would be $70 a month if you filled both of those monthly. And it doesn't matter how many times you fill them in a month.
And Gay, I know that we had this conversation and I can't remember, did we ever get a definitive answer? Someone had asked the question about oral insulin, which I'd forgotten my dad was taking.
Yeah, this is injectable.
Okay, so if it's oral insulin, it doesn't fall under the $35 cap.
I don't believe so. I think these are for injectables.
Thank you.
Okay.
All right. Well, folks, thank you so much for joining us. This has been great. Don't forget, next week, Gay's going to be speaking on current topics and coordination of benefits. So please join us 10 o'clock next Tuesday. If you've not registered for it, go right back to the same website where you registered before, and we will be there We can answer questions about the presentation. Also, if you've got other questions about Medicare, we'll have the folks from CMS, Angela, Carmen, who knows is going to be there. And we'd be happy to answer any questions you've got about Medicare. The recording of today's webinar will be available on the OID website at oid.ok.gov, probably about 3 o'clock this afternoon. Again, our phone number, if you'd like to talk to a counselor, is 1-800-763-2828. Please give someone a call and let's go over your Part D prescription drug coverage or anything else, other questions you've got. You got until December 7th to get this done, so don't delay.
And we're really encouraging people on insulin, get some help,
Yes.
or you're not gonna have any idea what your insulin, or your annual costs are gonna be, because the plan finder will not be accurate this year if you take insulin. That's
Yeah.
the only thing that we're most concerned about. Well,
Yes,
that's not the
absolutely.
only thing, but the main thing at this point.
Yes, and as Gay pointed out, it's capped at $35, but that doesn't mean your plan covers every insulin. So we still want to do a review to make sure the insulin you take is on the plan that you're selecting. So a lot of moving parts this year. Take advantage of the counselors that are available to you. So with that, I will tell you have a good day, and we'll see you next week.
Okay, I'll be there.